we will go ahead and kick it off with Governor Lee, followed by a brief health update from Dr. Lisa Piercy, Commissioner of the Department of Health, and then we'll have time for a brief Q&A afterwards. Just to reiterate, if everybody all members of the press can keep their mics muted, we have the ability to mute and unmute your mics. We will do that when we call on you for the Q&A portion. With that, Governor, if you'd like to kick us off.
Certainly. Good afternoon. Thank you all for joining us again in this unusual setting. I'll just make a few brief comments about the quarantine that Maria and I are taking, and then we'll have Dr. Piercy do a health update and take questions after that. First, before we do that, I want to acknowledge Manchester Mayor Lonnie Norman's passing as a result of complications, including COVID. And we certainly, our hearts go out to, and Maria and I are praying for the Norman family through this time. He was a great Tennessean who served for 29 years in service, public service to his community. Mayor Norman was the first African-American mayor of Manchester, and he is an icon in that community, and we are grateful for his service throughout the years. And we are saddened, and it's heartbreaking to know of his passing, and our prayers are with him. The flags will be flown at half-staff in his memory over the Capitol. Maria and I are quarantining at home as a result of one of my detail testing positive for COVID, tested positive today. And so out of an abundance of caution, we are following protocol, taking this very seriously. And I'll be working from home, as will Maria. And so we will be, Maria, I took a test this morning and am negative. Maria is home now. She'll be taking a test in just a few minutes or in a couple hours. And then we will be quarantined from there. So that's the update on us. Dr. Piercy, if you would like to give a health update, and then we will open it up for questions after you're done.
Is steady to slightly increasing. I'll start over because I think I was muted. Good afternoon. I wanted to talk to you this afternoon about some recent trends that we're seeing. In our case count, the numbers have been steady to slightly increasing. And while we're watching it closely, we've learned that there is ebb and flow in this. And so our antennae are up and we're watching, but we're not at a point where we are panicked by any stretch of the imagination. But I have noticed a couple of trends that are different than what they've been in the past, and something that I think you'll find interesting and want to take note of. One of those is a trend in our average age. You'll remember back in the summer, our median age was in the upper 20s or low 30s. Our average age of cases over the last 30 or 45 days has gone up by at least 10 years. Our average case age now is 43 years old, and our average hospitalization age is 70 years old. We've always had hospitalizations in our older population, but the thing that I want you to really pay attention to is our average age of case infection, which is, again, 43 years of age. That means this is no longer limited to younger people or college-age students who are out and about. This is now hitting those of us in middle age and those of us at higher risk. And so I think that's important for you to note. The other thing that I think is an important and albeit concerning observation is that our death rate in our rural population is double that of urban population. Let me repeat that again, because that has been very startling to me and the team over the last several days. Our death rate in rural population is double that in the urban population. That's not surprising on one hand, because we know that people who have higher risk of passing away from COVID-19 are our older and sicker populations. Saying that a different way, people who are, every 10 years that you go up in age, your death risk goes up, as well as with every comorbid condition. The comorbid conditions that are most closely associated with increased mortality are COPD or emphysema, hypertension or high blood pressure, obesity, and heart disease. Unfortunately, many Tennesseans have those conditions. And so particularly our older population with those medical conditions are at very high risk. So again, our nursing home population and our those with advanced age are still at very high risk, but I want folks to internalize the fact that those of us who just live and go about our normal daily lives are at risk of this and need to pay close attention. So to summarize that, again, it's ebb and flow. We're watching it closely right now. There aren't any specific new actions to take other than just a re-emphasis on personal responsibility. Do those 3 W's. Wash your hands, wear your mask, watch your distance, particularly if you're in one of those high-risk categories that I noted. One other update today is on the Binax Now distribution. As a reminder, that was an announcement that our federal government partners made a couple of weeks ago about the 150 million tests that they had procured and are allocating to the states. We have received our first 2 allocations and now have a couple 100,000 of those tests that we are getting ready to deploy. That's really good news, and we are finalizing our distribution plan right now. What we have learned is that there is a significant infrastructure that has to be built out when distributing those. And you also put that in context with, we know we are only going to be getting these allocations for about 8 to 10 weeks. And so while we do expect several 100,000 tests, and that's really good news, we want to make sure we get all of our planning done on the front end. So when we do start distributing those, we do it in the wisest fashion possible because we know they're somewhat time limited. We are already deploying some of those to our historically Black colleges and universities, or HBCUs, as well as our long-term care facilities, and working with several other partners to get that distribution and those logistics nailed down. Finally, I want to remind you, if you haven't heard already, it's time to get a flu shot. It is not too early. Flu season generally runs from October through April. I know that seems like a really long season, but we start to see those first cases come in every year in October or November. Haven't seen a measurable uptick in Tennessee yet, but every year we watch this pattern happen. And so October is the time to get your flu shot. And if you haven't done so already, I encourage you to do it. And if you've never gotten one before, this is the year to think about doing that. So call your doctor, look at the Department of Health's website for more information, but go ahead and get your flu shot now. I'll stop there and happy to answer questions later at the appropriate time.
Great. Thank you, Dr. Piercy. With that, we're going to go ahead and we'll open up the line for questions. First, we'll go with Kimberly Crucy from the Associated Press. Kim, your line is open.
Hi, Governor. 2 quick questions for you today. The first one, in the statement released by your office today, said that you would be in quarantine until further notice. Can you explain how long, or have you been instructed about how long you plan on being in quarantine? And the second question, we know that the First Lady was traveling today with the Education Commissioner, visiting a school in Middle Tennessee. I was just curious if Commissioner Schwinn has been asked, is testing now, or how is that all being instructing the school of that maybe that they could have been exposed? How is that kind of trickling down? Thank you.
So we're asking the health department about quarantine, but I assume that we'll be quarantining for 14 days, depending on what. So we're backtracking the last couple of days with this particular member of our detail to see what contact there really was and what constitutes important to remember that I'm not positive. Maria will be testing this afternoon. It's not likely that she's positive because her exposure to that particular detail was yesterday afternoon. And so Penny, for example, Penny Schwinn would be a contact of a contact. She was not in contact with someone who's positive, but we'll confirm all of that this afternoon when Maria has her test, and we'll move from there.
Got it. Thank you.
Mm-hmm.
Thanks. Next, we'll go from the Tennessean. Brett, your line is open.
Everyone. Two-part question. One, was the member of the security detail who tested positive, was that a result of a routine test, or did he seek out tests because of exposure or symptoms?
So
and
our
two,
okay.
You can go ahead if you want to answer that one first, Gillum.
No, go ahead.
Oh, and then two, it sounded like the governor just said that the First Lady's last contact with this member of the security detail was yesterday. Last contact with this member of the security detail was, and how extensive that contact was. Because
yeah, so my contact was my last contact with him, Brett, was yesterday as well, and so my detailer tested every week, and so he would have received a test last week showing that, and he was negative last week, but he received a test this morning because he was not feeling well. So he did not come into work today, and he got a test, and it was positive. Well, what was the first part of your question?
You answered it.
All right, good.
Next, we'll go to Chaz Sisk with WPLN. Chaz, your line is open.
Hi, thank you, Governor, and thank you for doing this online and respecting our space on this. I wanted to ask when you were informed of that positive test and whether that was before or after the First Lady left for Manchester this morning.
It was after I got informed. I don't know exactly what time it was, but probably it was mid-morning. Maria left, I think, this morning at around 7:30, and I got that information late morning.
Okay. And just a quick follow-up: if you do exhibit symptoms, what would be the procedure for the governor's office? Like, who would be in charge of the governor's office in that circumstance? Well,
I would continue to operate and work even with symptoms. And again, I'm negative today, but I don't anticipate that I would not be able to continue to work. I just need to be able to stay away from folks.
Okay.
Next, we'll go to Jacqueline Massey with Fox 13 in Memphis. Jacqueline, your line is open.
Thank you. And Governor, do you plan on taking another test? Because as you may know, you don't always exhibit symptoms right away after coming in contact with someone. And then my second question is, how do you plan on moving forward with your daily tasks if you do plan on showing symptoms, or even during your quarantine? Do you plan on doing things mostly virtually? Is that what your thought process is on that?
Yeah, that's right. So we've already begun to reschedule any events that we have to virtual, and again, I plan to work through this and hope I don't exhibit any symptoms. And your question about testing, so I'm going to defer to the Department of Health about how frequently and how often to get tested, but I suspect that I'll be testing on a regular basis over the next few days.
Next, we'll go to Andy Scher with the Times Free Press. Andy, your line is open.
All right, Governor. On a somewhat related note, there were efforts by some groups to get access to these red zone reports that are put out by the White House's Corona Task Force, and Tennessee was not providing those. Is there any reason why not? And I'd like to request a copy of those.
Yeah, so I'll let Dr. Piercy answer more definitively, but we receive information from multiple sources. We try to be as clear and concise as possible when we report data. Multiple streams of data from multiple places is not helpful to people. We understand that too much data from too many sources that's not all in one place is not always helpful. So that data is available in some websites, if I'm not mistaken. But what we've tried to do is assimilate information and then report every day, every county, strengthened that reporting mechanism. In fact, we've strengthened it just this week to make sure that people have access to one stream of information from the Department of Health that tells them exactly what's happening on the ground in their community and our state. Dr. Pierce, can you add to that?
Yes, sir. Just the fact of the matter is our data here in the state is more real time, and at least we know exactly where it's coming from. That's not to say that there's anything wrong with the data in the White House report, but there is more of a lag because the way they generate their reports is when we report our data to multiple national sources that we're required to do so, they take it from that report and then combine it together in their own report. So it's based off the data that we're already providing, and it doesn't add any new data to what we're already providing. In fact, the methodology that they use, because of the time lag and because of the combination of multiple sources, can be sometimes confusing. And so we strongly believe that the data that we're putting out is not only consistent with that, but it's more real time, and we know the exact source it's coming from.
If they're offering also recommendations saying, well, gee, Tennessee, in light of this, we recommend you do X, Y, Z, why shouldn't the public be able to see that if it's at variance with what the state is doing?
In all of those reports, the recommendations are exactly what you hear coming from our mouths, from the folks at the White House Coronavirus Task Force. It's something that Dr. Birx has been repeating over and over for several weeks. There are things like people need to avoid large gatherings. They need to wear masks when they're in public. It's nothing. We appreciate it, but it's nothing novel, quite frankly.
Your line is open.
Thanks, Gil. My question's for the governor. Any idea where this member of the security detail may have been infected? What's the contact tracing effort look like here? And is there anyone else in the detail or office staff that may be infected too that you know of?
Yeah, so we don't know the source of that person's infection, and contact tracing protocols for contact tracing will be as they are for any positive case. Everyone that detail has been traced, and those folks will be notified, and that's the way the system works and the way the process works, and we're going to follow the process entirely with this particular case.
Thank you.
Mm-hmm.
Governor, that's the time we have for today if you'd like to close us out.
Thank you all. We're great. I'm grateful for the opportunity to share this. Maria and I are feeling fine. We've received a lot of messages from a lot of folks. We are not sick and hope that we don't become that way, but we'll certainly keep you posted along the way. Grateful for your time today, and we will continuously update you from our offices at home. Thank you.